Hello everyone. In this video we are going to discuss about a normal sinus rhythm. But before beginning this video, let me first ask you to please subscribe to my channel. I'm Dr. Spinach, so please do subscribe. Okay, now let's begin this video. So in this video we are going to talk about a normal sinus rhythm on a graph. So we've already discussed in the previous video about all the waves. So let's just revise it once. So as we all are aware about, this one is P wave, this is QRS complex, and this is T wave. Again, a P wave which signifies atrial depolarization, a QRS complex which signifies ventricular depolarization, and a T wave that signifies what? Ventricular repolarization. Now we also have a PR interval over here. So this is a PR interval starting from the beginning of P wave to the center or the peak of R wave. Okay, so here also this is the PR interval. I will tell you why PR interval is important. I told you in the previous video as well. Anyways, there is another interval that is RR interval. Let's say this is R and this is R1. So this interval between R and R1 is about 0.8 seconds long. Now, let's talk about a cardiac cycle first. So in a normal human being, 1 R to R dash or R1 interval gives us one heartbeat. And that's true. One heartbeat is the atria will systole and diastole, and the ventricle will systole and diastole. And that is one heartbeat. So we calculate that one heartbeat from 1 R to the second R. So R1 is equals to 0.8 seconds is equals to one heartbeat. Now, heart rate is equals to number of heartbeats in 1 minute, that is 60 seconds. So that means number of RR intervals in 60 seconds. Now that will mean if 0.8 seconds gives one RR interval, then 60 seconds, in 60 seconds we'll have 75 RR intervals, and 75 RR intervals means 75 heartbeats in 1 minute or 60 seconds. So on an average, heart rate is equals to a normal person's heart rate may vary from 60 to 100 beats per minute. Now, if heart rate is less than 60 beats per minute, in that case this is known as sinus bradycardia. This will mean that less RR intervals, that means the RR interval is prolonged. So ECG will not be showing an RR interval of 0.8 seconds, but increased RR interval in case of bradycardia. If the heart rate is more than 100 beats per minute, in that case, this is known as sinus tachycardia. Now, this will be depicted in the ECG as more number of cardiac cycles in 1 minute. So, RR interval in this case would be decreased. I'm sorry. Yes, it would be decreased. So RR interval will come close and there will be more beats in 1 minute. So that is sinus tachycardia. So we have we looked into the heart rate, finding RR interval, identifying RR interval, and in that way identifying tachycardia or bradycardia. Now, what are the other features of normal sinus rhythm? Now, if you can look here, QRS complex, P wave and T wave. So if you can see, a QRS complex in this normal sinus rhythm is very narrow. So the first thing that you have to keep in mind is when you see a normal sinus rhythm, it should have a narrow QRS complex. If the QRS complex is not narrow or wide, then it will depict some problem in the heart. The second important thing is that, can you appreciate that every QRS complex is preceded by a P wave? Here, every QRS complex must be preceded by a P wave if you are watching a normal sinus rhythm. So you have to see for P wave whether is it before QRS complex or not. Very important. The third thing is that it should have a constant PR interval. A constant PR interval. What do I mean by that? I already showed you a PR interval that's starting from the P wave to the peak of the R wave. Let's say this is PR interval. Okay, so it should be constant in all the cardiac cycles. So this should be constant. This should be constant. Why? Because PR interval denotes AV node delay. Now, if PR interval is increased, that means there is an AV nodal block. That is why. And this we'll cover in Mobitz type 1, type 2 blocks and all the AV nodal blocks, first, second, and third degrees. And the final thing is that there should be a T wave after QRS. So a T wave should always be there. This denotes ventricular repolarization. Now, so a normal sinus rhythm, you will find a narrow QRS complex, P wave preceded by a QRS complex, PR interval should be constant, and a T wave that is succeeded by a QRS interval. Also, the RR interval should be 0.8 seconds. Okay, so that's finishes my section on normal sinus rhythm. In the next video, we are going to talk about arrhythmias and tachycardias. Okay, bye-bye, take care, and stay safe.